Hello, my name is Allison Barker, and I'm a health educator and epidemiologist for Data Strategy Services based out of Castle Rock, Colorado. I'm here today to talk to you about West Nile virus, the symptoms of West Nile fever, and ways to prevent the disease. West Nile virus was first discovered in Uganda in 1937. It cycled through Africa, the Middle East, Europe, and Russia for about 60 years, causing a mild illness among those infected. In the 1990s, a new strain arose that caused more serious neurological infections in Romania, other parts of Europe, Russia, and Israel. In August 1999, 2 cases of encephalitis, or inflammation of the brain, were reported to the NYC Department of Health and Mental Hygiene in Queens, New York, and similar cases were then found in surrounding areas. The Center for Disease Control, or the CDC, was pulled in to help identify which virus was causing these cases. Ultimately, this New York City outbreak in 1999 led to 62 confirmed cases, including 7 deaths. West Nile virus continued to spread each year, and in 2001, it was identified in 10 states between Massachusetts and Florida, totaling 66 cases. A large outbreak occurred in 2002 that resulted in 4,156 West Nile virus cases, including 284 deaths. These cases were reported as far west as Texas and Montana, and it was also discovered during this outbreak that West Nile virus can spread through blood donations, organ transplants, and breast milk. Eventually, by 2012, West Nile virus had been reported in all 48 continental states and the District of Columbia. This virus remained consistent between 2013 and 2018, with over 2,000 cases each year. So what is West Nile virus? This virus is the most common cause of mosquito-borne disease, so a disease that is spread by mosquitoes, in the continental United States. Although it can be found year-round, cases most often occur during peak mosquito season, which runs from the beginning of the summer through fall. We're currently in peak mosquito season, so this presentation is being recorded just on September 1st, the end of August. And this virus can infect birds, horses, humans, mosquitoes, and some other mammals, which we'll talk about in the next slide as well. So this chart is pulled from the CDC's website. It's depicting the transmission cycle of West Nile virus, or how it gets from the infected host to other animals or people. West Nile virus cycles between birds and mosquitoes regularly through nature. Some birds who become infected with the virus can develop high enough levels in their blood that when a mosquito bites and feeds, the mosquito then becomes infected. It takes roughly 1 week for the virus to develop in the mosquito, enough to where it can pass the virus along to other birds, people, horses, and other mammals. Although horses and other animals and people can become infected with the virus, we are considered dead-end hosts, meaning we cannot pass the virus along to other mosquitoes if we're bitten again. What are the symptoms of West Nile fever? Most people, so about 80%, will actually not experience any symptoms and will recover. So about 1 in 5 people will develop a fever with headache, body aches, joint pain, vomiting, diarrhea, and rash. Most people who experience these symptoms will recover, but they might experience some lasting fatigue and weakness for the next few weeks or months. However, sometimes people can have severe symptoms from the virus, including children and older adults. So children and older adults are at the highest risk for developing a severe illness affecting the nervous system. So about 1 in 150 people will develop a severe illness, mainly encephalitis or meningitis. Encephalitis, we mentioned earlier, it is inflammation of the brain, and meningitis is inflammation of the lining and brain and spinal cord. So along with these symptoms, you might have a high fever, headache, neck stiffness, confusion, extreme fatigue, coma, tremors, convulsion, paralysis, and muscle weakness. And these are some of the severe symptoms that would go along with encephalitis or meningitis. How is it diagnosed? West Nile virus is diagnosed by a healthcare provider based on a patient's signs, symptoms, history of possible exposure to mosquitoes that might be carrying the virus, and a laboratory test will be ordered for the patient's blood or spinal fluid to test for the virus. Typically, antibodies for West Nile virus will be able to be detected 3 to 8 days after an individual's symptoms appear. West Nile virus can be very dangerous for older adults and infants, as we touched on earlier. So it's not only important to recognize the possible symptoms of the virus, but also take precautions to help prevent the infection. There are currently no treatments or vaccines for West Nile virus in humans. There is a vaccine that's been shown to be successful in horses preventing the virus. If West Nile virus is suspected, the individual should be taken for evaluation to a healthcare provider as soon as possible. As mentioned earlier, children and seniors are at most risk for developing severe illness from the virus, and they should be extra careful during peak mosquito season. If a child develops encephalitis or meningitis from West Nile virus, hospitalization might be required for IV fluids, breathing support on a ventilator, further infection prevention, or IV treatments based on how severe the illness is. So this is a brief history of West Nile virus, specifically in the United States. This chart, it shows the number of reported cases in the United States from 1999 to 2022. So far in 2023, there have been 247 West Nile virus disease cases reported in the US, stretching across 34 states. This chart is all the reported cases from 1999 to 2022, split up into specific months of the illness onset, so when symptoms began. As you can see, based on past year's data, August seems to be the peak month for onset for West Nile virus. Although it's prevalent in the summer months into fall, there are still reported cases each month throughout the year, so it's important to be aware of the signs and symptoms. So this is a brief breakdown of the history of West Nile virus, specifically in the state of Texas. It was identified in Texas in 2002. There ended up being 202 cases reported that year. So since then, up until 2022, there have been a total of 5,901 cases total reported in Texas. Now, keep in mind, most people do not have symptoms, so this number can likely be higher if the disease was never identified in an individual. So far in 2023, there have been 20 reported cases in Texas and one specifically in Bell County. So here's the map just showing where the current cases have been reported in Texas. There are 20, as I just mentioned, and Bell County has one confirmed West Nile virus case. This is a recent news article talking about the first human case of West Nile virus that was reported in Bell County. So Bell County Public Health announced on Wednesday that a patient is a male resident of Bell County. According to the BCPH, there is no vaccine or specific treatment, as we discussed earlier. So once again, important to be vigilant and look for signs and symptoms and keep yourself protected. So why are we talking about West Nile virus now? And what can cause it to spike on certain years? Because we're in the peak summer months, there is officially a reported case in Bell County. It was important to us to get this training information out to you all so you're aware and can prep your homes accordingly for the rest of summer. As we mentioned, August seems to be the peak month for this virus to be spread, so we are not quite done with mosquito season as we're entering September right now. The country as a whole has experienced rising temperatures in the summer, so this can increase the rate of development, productivity, and abundance of mosquito populations. Increased rainfall can also lead to larger than normal mosquito populations, and they need water to lay eggs and breed. So with that more precipitation, there are more pools of water and puddles where mosquitoes can possibly lay their eggs. So how can we prevent West Nile virus, and what precautions can we take? First, using insect repellent that contains DEET is an effective way to protect yourself while participating in outdoor activities. It's super important to read the label on the back of the insect repellent and use as directed, though. They all are slightly different. Also, do not use insect repellent on children under 2 years old. Insect repellent can also be used on top of clothing for protection, but again, use as directed on the back of the packaging for brand-specific instructions. I've linked a website on the bottom of the slide. It can help you determine which insect repellent is best for you and your family. Second, the mosquitoes that carry West Nile virus are most active at night and early in the morning. So another way to help prevent illness is to avoid outdoor activities in the evening and early morning hours. If being outside is necessary, you can dress yourself or your children in long pants and shirts to avoid mosquito bites. Like we mentioned earlier, mosquitoes lay eggs and breed in pools of standing water. So staying on top of emptying and or replacing any stagnant water in and around your home is a great way to prevent mosquito pools where you live. Things that hold water can include flower pots, dog or animal bowls, bird baths, buckets, trash cans, tires, and more. So maybe take a look around your home, see if you see any standing water, and make sure to get rid of that quickly. Also, keeping away from creeks, ponds, and streams can be an effective way to avoid mosquito pools and being bitten. Lastly, ensuring all screen doors and windows are secure without holes can help prevent mosquitoes from entering your home. While it may be tempting to open windows when it's cooler in the morning and at night, this can allow mosquitoes to enter your home. So ideally, using air conditioning, if possible, is a safer way to keep your home cool while keeping mosquitoes and other insects outside. But if you do open the windows, just make sure all your screen doors do not have any holes in them. Here are some additional resources you can check out for more information on West Nile virus, mosquitoes, mosquito prevention, and I linked that insect repellent quiz there as well for you. If you have any additional questions, comments, or feedback, please reach out to Central Texas 4C's Health Coordinator, Ms. Nancy Gutierrez, via email with the subject line stated here. We're happy to answer any questions, offer additional resources, or anything else that you may need. Thank you so much. We really appreciate your time. And once again, reach out to Nancy at this email address if you have any questions. Thank you so much.